Hello again. I'm so sorry. I don't know what went on there. I really don't. Team, let me know you can hear me so I can just crack on with things. I just don't know what happened. We got fibered just outside trying to fix things, and I think that is the problem. We got some building work just on the road, so I think that's the problem. But you can hear me. Good. Right. I'm going to crack on again. I'm so sorry. I apologize for that. Okay. So I'm going to go through the slide. This is all part of showing that you're live, I suppose. Okay. So I'm going to continue. Okay. Actually, I think I'll just quickly do a quick restart. So welcome everybody. Welcome. I'm just going to do the actual slide show from current slide, and hopefully it's not going to mess up. So team, let me know that you can hear me fine. So we already did the welcome. We'll be able to chop up some of the items from before. Welcome to level 1. As I said, I explained the course objective, which is in the other live, which will be edited and tweaked so that this joins in together. So hopefully everyone can hear me. So home care services team, if you can just give me a yes. Because I can't see if I'm gone or not. Okay, so home care services. Services is provided to individuals in their own homes. And that's really important because what happens when individuals are in their own homes is that they are being cared for and looked after in their own homes. And service providers provide care workers to go and deliver the care, to do personal care, for example, or maybe it could be just to help with their well-being and mindset, or help to wash and dress, for example. So I needed to go through that with you so that you know the difference. So home care is where the individual lives at home and they're receiving care at home. So some of the organizations that you work with will be working in that industry where they're providing home care services. They could be run by the councils, which is the government, as well as private providers, like some of the clients that we provide a service to, or it could be a one individual who is providing self-employed contractors to deliver the package, which is called introductory care agency, which is like a matching service where the self-employed candidate is the private carer and they're the ones delivering the care, and they schedule the care that is convenient for the client as well as themselves. So there's different types of people that deliver care in that package. Sometimes with home care, clients they have complex needs. They need a lot of care. They need to perhaps be hoisted, where it takes 2 people to deliver the service because the individual's mobility is poor. So therefore they are being hoisted, or they need 2 people to help maneuver them in order from the bed to chair, for example. So sometimes you, as the virtual assistant, you may pick a phone up and it's the client's office phone, for example, and you're doing on call, and a package comes through, and the person requires to have maybe 2 carers or 1 carer, for example, to deliver the care, and they'll need to be assessed by the care manager who runs the day-to-day management within the home care agency. So you will have the care manager, you will have the carers that deliver the care. You could have a social worker that is there. It depends what type of agency that they're dealing with, for example, that you'll be working with. And it can range between the age group. So it could be 18 to 65 plus, or it could be 18 and under, for example, children's service, pediatric services, elderly services, adult services. Okay, so that's why I wanted you to be here, so that you understand these words and terminologies, so that you get used to it, because some of you may be scheduling rotas, some of you may be picking the phone up and doing on call, whereby the on call phone is a phone which is out of hours. So it would be, for example, a mobile phone that you would have, and the persons will call the business to say, hey, the carer may call and say, hey, my car's broken down, I'm running late, can you let this client know? Or they may ring and say, I can't work today, I'm feeling sick. And then you may need to cover and get someone to cover that shift, for example. So with home care services, that's usually how that runs as well. And the person then that is delivering the care will take a timesheet with them, and they get the person to sign, and then they bring that timesheet into the office, and then you are then you may be the one that's adding up the timesheets, that's adding up and verifying the timesheets for the client. So there's various roles within the home care agency that you may possibly be involved in. You may be involved in answering the phone. You may be involved in taking notes. You may be involved in putting the care plan, the care packs together, for example, or you may be involved in staff compliance. We go into that in the training as we go along, for example, to make sure what goes into a staff file. Now, there's various things that would go into a staff file, which is the compliance, the safeguarding, the training, etc., for example. So that's a bit about home care services, where it's being provided in the service user's own home. The next thing is, and with home care services, they are regulated with the Care Quality Commission. For example, it is a regulatory body who ensures that they are registered and that they can legally provide a home care service. If they are an organization and they are paying staff members taxes, for example, then they are liable then to be registered with the Care Quality Commission. If they are not providing employees and they're self-employed contractors, then they don't need to be registered. They just need to introduce the private carer to the client, for example, and then they get a small fee, for example. In these cases, what happens here is that they would have to register, be on a list, registered with the councils, for example, to ensure that they are on a registered list to provide care in the individual's own home. So then they would have gone through compliance, they would have met all the guidelines, the criminal records checks, etc., would needed to have been done. With home care, they get registered. It's meant to be yearly. They have to pass registration. They get inspected by the Care Quality Commission, who is a regulatory body. Whereas with recruitment agencies, because some of your clients may be recruitment care agencies where they're providing care to care homes, nursing homes, for example, private hospitals, private clinics, etc. They don't need to register with the Care Quality Commission because they are the organizations that they're going into are already registered with the Care Quality Commission, for example. So with the agencies that provide healthcare professionals on a temporary or permanent basis, the regulation by the Care Quality Commission is not needed if they are providing to care homes, for example. When they're doing medical staffing, like in the States, for example, you'll come across organizations who are doing medical staffing, and if they're doing home care, then they will need to be registered. But sometimes it depends on the county that the person is operating in. So it's so different because there's different types of medical staffing which involve doctors, nurses, allied healthcare professionals, and also there's the role of the NHS and the private sector in staffing, for example. Supported living is another form of care services, and that is where the person is either providing care where they're regulated with the Care Quality Commission, like on the previous slide. They're just going into supported living accommodation and they're providing care to the individual adults that live in that accommodation. Or they are supported living and they're providing accommodation. So therefore they are regulated with the Care Quality Commission. Sometimes they don't need to be registered with the Care Quality Commission because it depends on the type of supported living. If they're providing supported living with the accommodation, but without care, then sometimes they may not need to register with the Care Quality Commission. If they are providing supported living accommodation with personal care, then yes, they will need to be registered because personal care is a regulated activity because you are touching someone's body, for example. So this is the housing option for people with additional needs that is integrated with care and support services. The next thing is the regulatory standards. Key regulatory bodies like the Care Quality Commission, also known as CQC. So with you being a Alpha virtual assistant, you'll need to familiarize yourself with these names, these jargons, the terminologies that are being used so that when you hear it, you'll understand what is being said. It's important that the organization is compliant with the health and safety standards in order to keep their registration, in order to keep their regulated activity. They get inspected yearly. Sometimes it can be every 2 years, for example. Just drink my water. Just bear with me a second. So healthcare systems in the United States, we're going on to now. Healthcare structure and funding. There's mixed systems, for example, there's public, there's Medicare, and there's Medi-Aid. And we're going to go into this as we go through the week, but I just want to go through an overview of what we're going to be covering. There's private insurance, there's employers sponsored insurance, and private paid clients. So there's different types of private paid patients, for example. This is through the insurance company. Home care service in the United States, services provided by home health agencies. Now, before I was talking about the UK, we're going into a bit about America, for example. The role of Medicare, and private insurance. Because sometimes when you, the Alpha virtual assistant, you could possibly be on the phone, or maybe you could be on a screen, and the patient comes in to the organization and they want to be seen by a doctor, for example. So it's important that you're aware of these types of different terminologies. Okay, so agencies providing healthcare, for example, they're professionals and they provide temporary and permanent basis. Regulations are varied via state and federal agencies. So there's different, some locations, they don't require that people are registered, for example. Now we just go through some medical staffing terminology, different types of medical staff, doctors, nurses, allied healthcare professionals, the role of private sector and healthcare networks. But don't worry, we're going to be going into this in the week. That's why I'm doing the 4-week training, so that you get familiarized with hearing these wordings when clients speak to you. So, for example, if a client is doing supported living, housing options for elderly people with disabilities or special needs, the role of Medi-Aid and state programs, that is where they are being funded to pay for their care. And they need to fill out the forms and need to meet the criteria to show that they are eligible to have this paid for without it coming out of their own money, for example. So there's regulations and standards. So key regulatory bodies, for example, is Medicare and Medi-Aid services. There's also CMS, which is importance of compliance with health and safety standards. So you have to make sure that people are being compliant, which is really important, as well as the health and safety standards, the CMS. So comparing UK and USA healthcare systems, there's key differences, like I've mentioned here. There's funding models, taxation versus insurance-based, access to services and key similarities, the importance of regulatory compliance, which is focused on quality and safety of care, for example. Then there's application, and there's some case studies, some real world scenarios involving home care and recruitment agencies and supported living discussions. And I'm going to be discussing that with you tomorrow. So it's important for you as the virtual assistant so that you can be effective, so that you can support people in these scenarios. So we'll be doing some scenarios when we go through this, okay? So that you understand it, so that when you're faced with it, you'll be able to understand. So there will be some Q&A sessions that I'll be going through with you, clarifying any doubts about the healthcare system in the UK and the USA. I know we had a bit of a slow start today, so I'm also mindful of the time, and I know that it's getting on for you as well. So what I wanted to be able to do is just to talk to you today about the learning outcomes, where you'll be able to understand the basic structure and funding of healthcare systems in the USA and the UK. For example, that you'll recognize the roles and services provided by home care, because I want you tomorrow to be able to explain the difference between home care. Home care is when the individual is living at home and they're receiving care at home, and carers come in to the individual's own home and they may do personal care, where it's wash and dress, Or maybe they're giving someone mental health support where they may have dementia or mental health, for example, or learning disability where they need support, not personal care, for example. So it's important for you to recognize the roles and services provided by home care agencies. It's important for you as the virtual assistant to understand the difference between home care and recruitment care agencies. Recruitment care agencies in the UK don't need to be registered with the Care Quality Commission, CQC, for example. Just like when you're providing medical staffing, supported living, it depends on whether you're doing personal care or whether you're supporting someone with mental health, for example. So I want you to be able to identify the key differences, and we're going to go into that this week, and the similarities between the UK and the USA in the healthcare systems. And by applying this knowledge, you'll be able to effectively support healthcare professionals and organizations to be able to provide the service as a virtual assistant. So I just wanted to, let me just minimize this so I can see a bit more of you now. So we've just gone through that. It's only taken an hour, hasn't it? So does anyone have questions about what I've just spoken about? I think it's good that you look at the video and then you listen to the video, you make some notes. I've also got here, which I wanted to show with you, the glossary of terms that we're talking about today. And I just want to share with you all the document here. A document which is a glossary of terms that I'm going to be giving to you all so that you're understanding some of the terminologies and what the terms mean, because I feel it will be very helpful for you in your learning as a medical healthcare virtual assistant. So the key terms: healthcare systems. It's an organization of people, institution, and resources that deliver healthcare services to meet the health needs of the population that need it. Okay, so it could be the whole of the population, it could be the age group, it could be from babies to children to adults to elderly, for example, to end of life care, palliative care. There's different levels of services. There's mild, there's medium, and there's high needs. So home care service, glossary of terms, is services that allow a person with special needs to stay in their own home while receiving care, such as those with chronic illnesses, disabilities, or recovering from surgery. It may be temporary or it may be permanent or end of life, for example. Recruitment care agencies, who are they? What do they do? They're organizations that provide healthcare staff to facilities on a temporary and permanent basis. And that could be to care homes, residential care homes, hospitals, for example. You don't see anything. Okay. Sorry, I thought I was sharing this screen. Can you see me? Let me see if you can see me. I'm going to stop sharing and then I'm going to see if you can still see me. So you can still see me, but you can't see the glossary of terms. Is that what you were saying? Okay. All right. So the document here, which I thought I was sharing with you, which I don't understand why it didn't share with you, because the YouTube was saying share this document, for example. But I'll carry on talking about the glossary of terms because this is all part of your exam towards the end of the week so that you've got an idea. Okay. So I just spoke about recruitment care agency. I'm now going to talk to you about medical staffing. So medical staffing is the process of hiring healthcare professionals such as doctors, nurses, allied healthcare professionals to meet the needs of healthcare facilities. Then there's supported living, which is housing and support services, which is designed to help people with disabilities to be more independent. So they live in a house and there's multiple people that live in that house that need some form of care. It's not like the individual that lives in their own home that is receiving personal care. Okay. I just wanted to explain that. Supported living, it could be 3 or 6 people or more living in the same property that's having personal care, and each individual is not a family member. Okay. The National Health Service is known as the NHS. Who here knows the NHS or has heard of the NHS, for example? This is a public funded healthcare system in the United Kingdom. It provides healthcare services and it's free to the point of use for those that are UK residents, for example. The next one I'm going to speak to you about is Medicare. Medicare is a federal health insurance in the USA. And this is for people aged, usually they're 65 and older. For some, it could be younger people with disabilities, for example. Medicaid is a joint federal and state program in the USA that helps with medical costs for people with limited income and resources. So they have to have it where the government pays for it, like in the UK NHS. Whereas with private pay, private insurance, health insurance provided, they're the ones that are private companies rather than the government. And often individuals pay through being employed, and they've got like a plan of some sort that they pay for this insurance. And then when they need to receive the care, then they're entitled to private paid, and they can have their care at private hospitals rather than at a state hospital, for example. Electronic medical records are also, oh, sorry, that's someone else's message here. Yeah. So, for example, electronic medical records is also known as EMR. That stands for electronic medical records. And this is a digital version of patient paper charts containing medical and treatment histories. So sometimes you'll be involved in that, where you'll be making notes while the doctor or the nurse is talking to the patient, like I am online here, for example. You're online, you're not directly seeing the patient and they're not seeing you, but you're in the background making notes. They may introduce you with a say an iPad and say, this is my virtual assistant, and she's going to be doing the charting while I'm talking to you today, for example. It just frees their hands of being able to connect with the patient whilst you're making the notes. And they tell you what to say as well. It's not like you're having to make things out of nothing because you're not the doctor, you're not the nurse, for example. So the next one is HIPAA. Now, HIPAA is Health Insurance Portability and Accountability Act. That's what HIPAA stands for. I'll repeat that again. Health Insurance Portability and Accountability Act. You will hear this and you will see this a lot if you're working with clients in the States, for example. It's a US law designed to provide privacy standards, for example, to protect patients' medical records and other health information. This is ensuring privacy data is being kept to the most high and protected without being exposed or given away to someone that doesn't need to be involved in this. Another terminology is regulations. Regulations means rules or directives, and it's made and maintained by an authority to regulate the conduct within a particular field, such as healthcare. So I'm explaining to you the terms, the glossary of terms here. The next one is compliance, for example. Compliance means, for example, adherence to the laws, regulations, guidelines, and specifications relevant to the business operation, particularly in healthcare. And you'll be a part of that. So it's important that you're aware of this, for example. Regulatory bodies in the United Kingdom, there's the Care Quality Commission, known as CQC. They're an independent regulatory body, health and social care in England, ensuring that health and social care services are provided to people that is safe, effective, compassionate, and high quality care. Then there's the National Institute for Health and Care Excellence, known as NICE. This is where they provide national guidance, for example, and advice to improve health and social care. This is in the United Kingdom. Then there's the General Medical Council, known as GMC. This is to regulate doctors in the UK, aiming to protect, promote and maintain the health and safety of the public by ensuring people's receiving proper standard and in practice and in medicine, that there's no harm to anybody receiving the medical practice care. In the United States, there's the Center for Medicare and Medicaid Services, CMS. It's a federal agency within the United States Department of Health and Human Services that administers the national major healthcare programs, including Medicare, Medicaid, and the health insurance marketplace. Then we have the Food and Drug Administration, the FDA, responsible for protecting public health by ensuring safety, efficiency, and security of drugs, biological products, and medical devices. So we have to ensure, for example, some clients may need a peg feed if they're being nursed and they're being fed through their stomach because they can't have food through their mouth, for example, or they're having medicines, or they're having food which is being given to them that is safe, medicines through the mouth. There's the Joint Commission in America, It's an independent and a non-profit organization that is accredits, and it also certifies nearly 21,000 healthcare organizations and programs in the USA. There's Occupational Safety and Health Administration, known as the OSHA for short. This ensures safety and it ensures the health, and it ensures that the working conditions are set and enforcing the standards, and by providing training, outreach, education, and assistance. So you'll be getting a copy of this glossary for those of you that are here today. And this is what we're going to be looking at during the week, as well as the training at the end of the week, where you'll be doing an exam, for example, okay, about what we've covered in that week. So I wanted to point that out to you. It is a Word document, and I will get the team to send it to you in the dashboard that you'll be receiving. Once you get access to the dashboard, you'll be able to not download the video, you'll be able to watch the video once we've put both of them together, because obviously we've had a bit of a disconnect today, which has caused this to be in like two parts, this video. So does anyone have any questions? You're welcome. Good afternoon. I hope everyone's enjoyed today's training so far. The training is usually about an hour to 2 hours. And then I always like to leave some time for those of you that may have some questions. Does anyone have any questions? My team will be sorting out the dashboard for those of you that have been vetted and we've gone through your applications, for example, so that we can then create the dashboard, your learning dashboard that you'll be able to access. And I believe, Jaya, when do you think Randa will have the dashboard ready for the students to be able to look at this? Will this be probably ready, for example, Wednesday? Or do you think it'll be ready tomorrow? But I'll let you answer that anyway. We can answer that question tomorrow because I know it's late. Anytime now. But we've got to edit these two parts to make sure that it runs smoothly. Okay, so not anytime now. It'll probably be tomorrow. What do you think? Tomorrow's better because I want to make sure that it looks good as well. Okay? Don't rush. I don't want anyone rushing because it's late. I want you all to be able to receive the information tomorrow. Once we put the two videos together, then for those of you that have provided the information, for example, then you'll have access to your training portal, for example. But does anyone have any questions before we finish up today? Because I know it's late for some of you. Did you enjoy it today? Apart from the beginning, just goes to show it's live. Just I don't know if you can type in the chat, actually. Just see. So I kind of rushed to get this on, didn't I? Good, good, good. Excellent. Good. Excellent. Now I can see the messages now. Excellent. I'm glad that you're enjoying this, because can you see why I said about starting at level 1? Because there's the healthcare industry, which is huge, that you've still got to go through. Hospitals, there's care homes, what happens in a care home, because otherwise you're going to feel lost. So, good, good. You've got no questions, good. Excellent. I'm glad that you've enjoyed it. So thank you. Thank you very much, Alpha Virtual Assistants. Thank you, team, so much. You didn't need to be on, but I'm glad that you was, because you helped out today. So obviously this was a troubleshoot at the beginning, but we sorted it out. So thank you so much, everyone. Have a blessed day, and I look forward to the training tomorrow. Anyone got any questions? If you do, you can always reach out to us in the group as well. Okay, so we've got our chats all set up. Tomorrow training will start on time. You're welcome. You're welcome. I'm glad that you've all managed to attend. I really do appreciate you take the time out, because it really will give you a better understanding, and then that way you're not feeling so lost when the real time comes. You know, I'm trying to prepare you so you know what you're dealing with, rather than just sort of being thrown in kind of thing. Okay, so thank you so much, everyone. It's been such a wonderful pleasure you being here today. I've really enjoyed training you all today, and I look forward to you getting the training video for you to access. And I hope that you've learned a lot. Please read through the glossary of terms so that you understand what each one means, because that's going to be part of your exam at the end of this week. So that is a Word document. I'm going to share that with Jaya, so that she'll be able to get the team that does the dashboard for you to access, so you've got that ready. Right then, so thank you so much, everyone. Have a blessed day, and I look forward to the training tomorrow. Take care. Thank you. Goodbye. Bye, everyone.